Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about plantar fasciitis. And we're going to do this more than usual. So let me actually start with basically what it is. What is plantar fasciitis? So to understand that, you need to first understand what the plantar fascia is. So in the foot and ankle, you have bones, of course. You have blood vessels and nerves. But you also have tendons and muscles and ligaments and fascia. Fascia and ligaments are very, very similar things. And for your understanding, you can basically consider them identical. They're basically very, very similar. So when you look at the foot here, you've got the Achilles tendon that attaches to the gastroc. Underneath, called the plantar fascia. The plantar fascia sits on the bottom of the foot, and what's going to happen is when you're walking, they're pulling against each other. The weaker of the two is the ligament, and so it starts to pull off. It gets inflamed, painful, and tender. So what it is, it's an inflammation of that ligament, inflammation of that plantar fascia, or you could say it's an injury or like an ankle sprain. So an ankle sprain is an injury of ligaments. Plantar fascia is an injury of the plantar fascia. So because of that, it gets inflamed, painful, and tender. And when you walk, you get pretty significant pain. So how does it present? Most of the time, people are going to start to notice because their heel kill. If they walk a little bit, it starts to get better. But if they go sit down again, it gets worse again and starts to get inflamed, painful, and tender again. So you've got an inflammation of that plantar fascia. When you sit down or lie down at night, the foot relaxes. It starts to try to heal, and it gets better while you're sleeping. And then when you get back up, you start over because the ligament's tight again, and it's pulling, inflamed, painful, tender, and you get pretty significant discomfort and pain in that situation. So plantar fasciitis can be very problematic. It can get to the point where you can't do the activities you're normally doing. It can get to the point where you can't hardly walk without pain. It can get to the point as well. You sit down at work to get up, it can be pretty painful again. Or again, if you're driving, a lot of times people say they drive to work and then they try to get out of the car, they can hardly walk. So it's a significant problem. It can be pretty debilitating and pretty problematic. So this is plantar fascia, and hopefully that helps you understand a little bit what it is. So if you have heel pain or arch pain, and it seems to be worse first step of the morning, seems to be worse if you sit down for any period of time, and it doesn't seem to be getting better, even with you trying to limit what you're doing, it's often plantar fasciitis and a lot of times may require treatment. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day